And I am going to stop sharing. And there's David. David, welcome. And I'm real excited to have you back. You were one of the first guests that I had when I started doing these discussions, and it was an incredibly popular discussion the first time around. And I understand you've got even more information for us this time on healthy lighting for older adults. So thanks for being here today.
Thanks, Steve. Thanks for having me. And as I've told you, I am a data dumper. So yes, I have more information. I'm going to try to put 10 pounds of potatoes in a 5-pound sack. So we'll see how it goes. We'll see if I can
I,
finish in time.
I love it. No, this is going to be great. And before we dive in, I know you've got some PowerPoints and some data to share with us. But before we dive into that, um, uh, tell us a little bit about your background and what got you into this field of lighting for older adults.
So I've been in the lighting business for about 20, 25 years, and I had a commercial retrofit company. We did a lot of commercial industrial work. So I went to all the shows, went to the seminars, and about 15 to 18 years ago, I started seeing a lot of experts talk about how affected human physiology, neurology, and I became fascinated with it. I'm a data hog, so I started attending and reading everything I could, and then the topic became very personal when my father fell in his home, broke his hip, died a few weeks later in skilled nursing. And I knew of a study that was coming out that showed that proper lighting could reduce falls by as much as 43%. So having that personal interaction with my dad and then seeing that research come out, I really wanted to give back to the community and see how we could help seniors avoid it. And now that lighting is in my mother's house and in nursing homes and other facilities around the country. Steve, we lost your audio.
Okay, there we are. Can you hear me now?
Yeah, gotcha.
Okay. You're going to share your slides in a moment, but before you do, folks, I want to share with you. I took this video literally a half hour ago at Brightview Severna Park, where I'm at right now, and let me share this with you because I think this is so cool. This is a nonprofit called Cycling Without Age. And what it strives to do is get older adults the wind in their hair and get them out on bikes. Many times, the first time being on bike for years. And this is just a brief video that I literally shot here. Can you see that, David?
Yeah. Oh, yeah.
Okay. So what you can see is you can see these two ladies.
When was the last time you all rode a bike?
This is a volunteer that comes out, and they've got these amazing
oh man
from the Netherlands, and they set these up.
I wouldn't mind seeing what it feels like to ride on there.
Of senior living communities there. So anyways, I know that was a little distraction there, but it was fresh video, so I figured I'd share, and it also explains why I've got a little bit of a different background, and probably my audio isn't what it usually is. But so David, really excited for you to take it away. And I want to remind everybody as you share your screen that folks, you can share if you've got questions when David starts jumping into the data on lighting. Feel free to just type it into chat or Q&A.
There you go. Can you see my screen, Steve?
I can. Looks good to me.
All right. So whether you're a senior caring for a senior or an executive in senior living or just learning how light affects you, I think and hope the presentation applies. We're going to talk about how lighting improves senior living. As you know, I'm David Thompson, founder and CEO of Healthy Senior Lighting. And as I mentioned earlier, this is going to be a data dump. So buckle up. And if you want more information, at the end of this, you'll have my LinkedIn profile for Healthy Senior Lighting, as well as my personal email, and either I or a member of my staff will get back to you. So our goal today, and a goal for you, is to use light to preserve senior independence. What's the number one thing that stops that? Or falls, slow physiologic, neurologic decline, and increase senior vitality. I'm not going to bore you too long with the science behind it, but basically seniors spend about 97 to 100% of their lives indoors. And existing artificial light ignores the physiologic and neurologic impact, only really looking at light levels, energy usage. And those light levels, by the way, if you have legacy lighting like fluorescence, those degrade over time and they're not readjusted. So the architect specified the space for a certain level, and you may now be at 50% of that light level. So seniors, because they're inside so much, they miss the benefits of sunlight. And light is the body's primary timekeeper. About 2% of your retina is comprised of nerve cells that do not go to the vision parts of your brain. They go to other parts of your brain that control not just sleep, which is your circadian or sleep-wake cycles, but impact nearly every physiologic and metabolic function in the body. Your hormone secretion, your proteins and your compounds that control muscle repair, fat metabolization, production of disease-fighting cells, and the list goes on. So when you think of sleep, it doesn't, or think of light, it doesn't just control your sleep, it controls a lot of other body processes. All light is alerting, but those cells in your retina are especially sensitive to what we call blue enriched light. Think of it in terms of daylight. We've only had artificial light for 125 years. And so this will kind of make intuitive sense to you. Since the dawn of time, our active, productive light source was daylight. And our active and our relaxing and sleeping light was firelight or darkness. And artificial light, almost all artificial light you see in every building, is typically the spectrum of fire, which is sedating. So since seniors spend so much time indoors, they're producing those sedating hormones and compounds during the day, the main one being melatonin, when they really need it at night. Melatonin triggers sleep. It doesn't keep you asleep, but it triggers sleep. So they're missing out on the alerting effects of cortisol, dopamine, serotonin you get from blue enriched light during the day, and the results are all bad. So I'm going to blow up that diagram on the bottom just a little bit to show you how sleep interacts. Sleep is obviously critical for health, both physiologic and neurologic. So you want a standard good sleep cycle is going to bed at 10, waking up at 6. So here are the hormones, the two primary hormones that we're going to look at. Your cortisol, which is your active, productive hormone, should be spiking about 9 a.m. So that's why you want morning daylight. Is very effective to get that spiking. And you want your melatonin producing peaking at about 3 a.m. So those are both critical or good cycles to have. When you're looking at your phone within 2 hours or any other screen, in 10 minutes, it shuts off all your melatonin production and produces cortisol, dopamine, serotonin. So Harvard study said it's more effective than caffeine in keeping you awake. And then you fall asleep from exhaustion, not this natural cycle that nature has had forever. So just a 2-hour differential in your sleep-wake cycle increases your likelihood of depression, body mass index. So for example, when you look at third shift workers, they are 96% more likely to be obese. So this BMI is an issue. A resting heart rate will jump by 5 beats a minute just from a 2-hour differential. So you go to bed at midnight on the weekend instead of 10 a.m., it has negative effects. You want a standard natural sleep cycle. So what are the long-term health implications? Cancer and disease? Just one night of sub 5-hour sleep reduces your quantity of cancer and disease killer cells, your T cells, TH cells, and killer cells, reduces the production of those cells by 70%. Remember those all-nighters you pulled in college and you couldn't remember anything? That's memory consolidation, and then you got sick afterwards. This is why. Your diabetes risk, sleeping less than 6 hours a night makes cells 40% less effective at absorbing glucose. It blocks cellular insulin absorption after just 1 week. If your blood were tested, you would be considered pre-diabetic, sleeping less than 6 hours a night. So what about all those negative effects that we know for third shift workers? Heart health, blood pressure, stroke. When you sleep less than 6 hours a night, you increase your arterial calcification by 200 to 300%. And if you do that until age 45, you can't cheat sleep. So by age 45, those who sleep less than 6 or so hours a night increase the risk of a negative cardiac event by 300% over those who sleep 7 to 8 hours a night. Weight loss, you increase the hormone ghrelin that stimulates your appetite and reduce the hormone leptin, which suppresses appetite. So you don't get enough sleep. What do? You wake up and your body craves carbs and caffeine, right? We all kind of do that. And now let's look at how it affects the brain. Just depression and anxiety. Less than 6 hours of sleep reduces the stage of sleep cycle that control depression, anxiety, and impulsiveness, as well as memory retention. And you also have a tendency to build up these brain compounds called beta amyloid proteins. And for those of you in the medical community, you know that they are closely tied to Alzheimer's and dementia. And for those of you who are female, I'll just give you a little hint. You can tell your significant other, females do require more sleep than males. So what are some senior specific challenges? And the main one that I like to look at is the yellowing of the lens. An 85-year-old lens, and you can see that's a 91-year-old lens on the lower right. An 85-year-old lens only allows in about 5 to 8% of the light that an 18-year-old lens does. So seniors are walking around in this dim environment. So you have to have a well-lit facility. It affects appetite. Appetite is closely tied or correlated to color. By the time you get to 70, 80, 90 years old, your peas start to look gray. Your carrots look gray. They're not orange anymore. And so it's just not as appealing to eat. So you don't eat as much. Seniors have the highest rate of depression of any demographic. And one thing that's frequently overlooked is rhodopsin depletion. So think of rhodopsin as the chemical that allows your eye to go from a bright room to a dark room. When you look at the lens, that's one thing, but now we're looking a little bit at the retina, and you go from that bright room to the dark room when you're in your 20s, and it takes you a few seconds to adjust. Do that in your 80s, and it could take as much as 30 minutes to fully adjust. And lastly, melatonin production. As you age, you can only produce so much melatonin, and it declines with age as beta amyloid proteins build up on your SCN, a part of your brain that produces melatonin. And so you don't produce as much, and we've got them in lighting that sedates them during the day, the incandescence and the fluorescence that were specified from the beginning, and LEDs that now are specified to look like the incandescence and the fluorescence. So what are some outcomes out of that? I love the I've fallen and I can't get up. And by the way, my 96-year-old mother who lives alone definitely has a life alert around her neck, just in case of those falls. But one thing is poor sleep. Seniors don't sleep as much as others. And there is a 50-fold differential on sensitivity to light. So some are more sensitive to light interacting with their sleep. But one of the main things are fall risk. You have a yellowed lens. You've got a significant fall risk. Seniors over 65, about 30% fall each year, resulting in 3 million ED visits. This is one of Medicare's largest, Center for Medicare Services, CMS, one of their largest expenses, currently $50 billion due to falls and rising to $100 billion by 2030. And by the way, if you're a value-based care provider now, Medicare's goal is to have everyone, right now it's about 54% on capitated plans or value-based care or Medicare Advantage plans, about 54%. It's rising to 100% by 2030. So what happens when they lose the appetite? They get cachexia, and I used to call it cachexia. It's a mispronunciation. Cachexia, or wasting away. They just don't eat, and they kind of waste away. That's another result of bad lighting. They're just not engaged. Your light is static. You're just don't have an engaging environment. And then for depression, you get prescribed benzos, trazodone, SSRIs, all of which are categorized by the FDA as FRIDs. What is an FRID? A fall risk increasing drug. They double fall risk. And in the case of SSRIs, I had a discussion with a CEO or CXO, I think she was actually the COO of a relatively large senior living provider. And she said, "Oh, we only do benzos and trazodone for depression." Or no, we only do SSRIs. We don't do benzos and trazodone. That's when I discovered that not only do SSRIs double fall risk, but they give you up to as much as a 674% increase in the risk of hip fracture. So reducing depression is absolutely key. And all of this obviously leads to rapid decline. So you can call it human-centric lighting, you can call it bio-optimized light, but if you look at that graph on the right, and I don't know if it really shows it, but you can see that even overcast daylight, that's the solid line that kind of peaks up in the blue in that diagram, even overcast daylight has a giant quality of blue and rich light, and sunset or evening or firelight does not. And this is backed up by about 25,000 peer-reviewed research papers. We can manipulate light to mimic that inside. We can improve mood and awareness, slow cognitive decline. I saw a study where we were able to reduce, it wasn't my study, it was Pacific Northwest Labs, I think. They were able to reduce dementia outbursts by 53%. And that anecdotally holds true in the facilities that we've modified. Reduce pain tolerance by about 20%, less pain, and reduce senior insomnia or sundowning. Now, think of that in terms of not only the senior, where they're getting more restorative sleep, but think about that in terms of your staff, that no longer the third shift is really panicking when the seniors are up and wandering around. Or if you're a caregiver at home, they're going to bed at 11 o'clock, not 3 in the morning, wandering around. So, certainly something to consider. So reducing depression is key, again, because of those fall risk increasing drugs and reducing that fall risk. A recent Harvard study with the Midwest Lighting Institute showed that falls were reduced by 43%. So you're affecting your bottom line, your risk, all of the above, and keeping your beds filled. So, Steve, I'll break here for a couple minutes. Do you have any questions that have popped up as I've data dumped through that first section?
You did a great job. This is fascinating, and nothing in the queue yet. But one of my questions is, and you sort of alluded to one of my questions is, are you finding that more senior living communities are open to updating their lighting, and this is something that, to me, that makes perfect sense, but it's also something that we should all be doing in our own personal residences as well.
Absolutely. This does not only apply to seniors, although I think they have the biggest impact because they spend such a significant amount of their lives indoors, but it applies to everyone. And when we approach senior living communities, a lot of people don't realize that senior living lost 15% of top line revenue during COVID. And that was a big hit to the industry. So if we have an existing facility, everybody's interested in hearing it, right? And there are practical tips that you can apply, which we're going to talk about in just a second. There are practical tips you can apply that don't even require you to change out the lighting. But obviously lighting and changing that lighting inside is incredibly effective.
Okay.
They're interested in talking about it, but they don't have the revenue. So we try to wrap this into, if they've got fluorescence, it makes perfect sense because there are energy savings and they're going to eliminate maintenance issues with replacing burnout light bulbs. It makes a lot of sense, but you need to provide them. We provide them also with an option to have no capital expenditure. We take over their energy spend to remove the capital constraints that they may have
Oh,
to solve
so
that problem.
saving it, they can pay for it through saving energy.
Correct.
Okay.
Correct.
I knew this would happen. Let me just hit you with these two questions. You may be answering them later, but we like to have all of our audience members get their questions answered. Ruth asks, what to do about light with older adults with macular degeneration, the low vision disease? And then C. Donnelly says, what is the effect of an LED light bulb? I don't know if you want to comment on either one of those, or
I'll comment on both quickly.
Okay.
Macular degeneration, that's a separate topic. Basically, there is research coming out, but really we're not able to affect macular positively. I mean, the center of your retina just kind of rots out. Obviously, more light is better, but we're not able to slow or improve macular degeneration currently. I don't know what's going to happen in the future. And now with LEDs, it kind of ties into this slide here, actually. If you look at the before and after, you can see this is just a sample facility we did, and it doesn't really do it justice. That before section, if you're looking down that hallway, that was actually, we measure the light levels. We do a before and after, both behaviors of the occupants, the patients, as well as the physical plant. And in that case, they had 1/3 of the light that would be required based on the original LED fixtures, the light that would be required for an office space. They were a fraction of what they needed. Now, I'm sure that the architect was well-meaning. We want people to be relaxed, etc. What he did is this was a memory care facility, he turned the occupants into zombies, wandering around all day long. And my installers, when we got done, and by the way, that is not a digitally altered photo on the right. You can see the change in coloration, the brightness, etc. And it was even more marked than you see here because my camera automatically adjusted the aperture on my phone. It was my installers told me, we thought your lights were hocus pocus. The first day we were in here, these people were zombies wandering around. And day 2, we had to corral our materials. We had to, they're asking us questions. They're bugging the crap out of us because you woke these people up. I said, yeah, that's what we do. We wake them up during the day and then they sleep better at night. So this is just a sample facility that we did recently. And back to the question on LEDs, if you see that night light in the middle, I don't know if you can really make it out, but that's a night light that was in a bathroom. That is a high Kelvin night light. If that, and it was in every one of the rooms, not in this facility, it was actually in a different facility. It's waking those patients up, those occupants, when they went to the bathroom. And so you end up waking them up even further at night and don't get that, they go from a bright room to a dark room, and no wonder they had a high precedence likelihood of falls. That facility actually had a higher percentage of falls than any other facility we've been in. So what are some solutions? Well, my favorite is get outside, and this applies to everybody, 4 to 5 hours a day. Now, the reality is nobody does that. But 20 minutes of the first hour of daylight is critical for everyone. It jumpstarts your mitochondria, which are the energy engines of your cells. It's really critical. It burns off adenosine, which is a way that your body tells it needs to go to sleep. So 20 minutes of first hour of daylight is critical. Open up blinds, etc. Whatever you can do to get outside for you personally. Or install indoor lighting that replicates sunlight during the day, takes it out at night. And you can see a light bulb up there that's a programmable light bulb that does that. We can retrofit any fixture, pretty much any fixture, to replicate daylight during the day and firelight at night. And there are bulbs, there are fixtures that do that. You want to control that circadian or sleep-wake cycle for your residents. You also want a really high, what we call CRI, color rendering index. Look for something over 90 that is in your that you're replacing your lamps with. Bulbs, we call them. You call them bulbs in the industry. We call them lamps. You want a fixture or a light that improves that color saturation. And a lot of fixtures or manufacturers will skimp on the red, and that's where you get the gray peas and the gray carrots. We actually pump in, make sure you get a really high CRI, 90 plus. I like 95 plus, where it actually gets closer to sunlight. Sunlight's 100. That's how the metric works. And then for the rhodopsin depletion, instead of having them turn on a light when they get out of bed, there's a really cheap option, whether you're caring for a caregiver or you're a caregiver for a senior at home, or whether you're in a facility, a really inexpensive option. It's strip lighting. It goes under the bed. You put your feet over the side of the bed. It's on a timer. It's on a motion sensor, lights up the floor with a low Kelvin. Kelvin is, you want a low Kelvin, a warmer light, like firelight is about 1700 to 2500 Kelvin. An incandescence like 3000 Kelvin. Daylight, like a blue sky, is 8000 Kelvin. You want that low Kelvin, very warm firelight across the floor. So it's a non-rhodopsin depleting light. So now they don't have to flip on a light. Lights up the floor. They can go do their business. You've got a target area or a landing area. They can do their business in the toilet, walk back to their room, and everything shuts off automatically. Lowers your fall risk. If you've got somebody with some serious vision problems, back to the macular degeneration, you can put the same system around the perimeter of the door frame. Lights up the perimeter of the door frame. Inside and outside the bathroom, they do their business. They walk back, a non-rhodopsin depleting light. My mother, again, 96 years old, made fun of me when I put this in. I was mocked, and now she swears by it, swears she can't live without it. And whenever she kicks out the plug or something goes on, she's got to call me to put it back in. So very, very effective, very inexpensive solution. A third of all falls occur at night, so you want to really make sure that that night lighting is taken care of. So what are some behavioral or protocols that you can do? Get seniors outside. If you got a memory care facility, get them out to the patio. Turn on those white or blue enriched lights right away. Open shades. In some facilities, especially if you're in a wooded area, remove the shades. Just pull them out. You don't need them. Get them on that natural sleep-wake cycle with daylight. You want to keep those beds filled, slow the neurologic and physiologic decline, get that daylight in there. You'll get some initial complaints, but I was originally alerted to this when I went to a facility in northern climates. And by the way, fall rates go up in the winter in northern climates and drop in the summer, where they're getting a little bit more natural light. And I went to this memory care facility, and by just natural what they wanted to do in the dead of winter, they all crowded around the only south-facing patio door where all the sunlight was coming in. Just a natural thing that they wanted, that sunlight intuitively. Second shift, turn off the white lights, the bright blue enriched lights, and lower the temperature of the room if possible. Your core body temperature needs to decrease by about 2 to 3 degrees to get deep restorative sleep. So you don't want them overly warm at night. And we talk about employees. If you see that picture on the right where she's got the eye shades on, you want your employees to regulate their own sleep hygiene. When we do a facility, we provide videos, and I should really put these online publicly. And I'll do that probably soon. But regulating your sleep hygiene at home, sleeping in complete darkness, making sure that you're getting more than your 5.25 hours a night, which is what the average third shift worker averages. What are some practical solutions, whether you're at home or in a commercial residential facility? Programmable smart lights. You can make them programmable where it's app driven or a centralized control system in a commercial environment. You can also have dim to warm, where you dim it down with a dimmer that can handle LEDs, and it warms that light down and gets rid of most of the blue. Switchable. There are some new lights which are out, which you can flip the switch a couple of times and it does something. Obviously, that doesn't work in commercial facilities or in memory care. Again, a high CRI and no flicker. Cheap programmable lights or cheap LEDs have flicker. Flicker triggers migraines in about a third of migraine sufferers, and they create malaise or fatigue in everyone. And you can test this at home. Test your flicker on your cheap LEDs, which you always went to the cheap thing that you saw at Home Depot or Lowe's. You put your phone on slow motion. It doesn't work with iPhone 13, 14, or 15, but it does work on earlier versions, and it works on 54 per second frame rate. Put your phone on slow motion and record it. And if it is playback, just 5 seconds, play it back in slow motion. And if it plays flicker, you've got flicker. I had one woman we did this for in her home, in her residence, and she had been bedridden during the middle of the day. The place was dark when I walked in. It was in Florida too. I walked in, her house was dark. I said, why is it so dark in here? Well, I get migraines. I said, okay, we retrofitted all her lights. And she happened to be the mother of a medical practice. And he walked in there 2 weeks later and he said, Mom, what are you doing? Well, I'm making lunch. Why don't you and the kids come over, you know? And he's like, Mom, I haven't seen you out of bed in the middle of the day in 15 years. She said, oh my God, it's the lights, the lights. I don't have my migraines anymore. So big change there. So limiting nighttime screen usage. This is critical for your employees. That spectrum of light that comes out of that screen is the same spectrum of daylight. It shuts off all your melatonin in 10 minutes. You fall asleep from exhaustion. It takes 2 hours to restart that melatonin production at the rate it needs to. Vitamin D supplementation, study after study after study. Obviously, consult with your physicians, but we need vitamin D supplementation for seniors to reduce the risk of fractures. Strength training actually not only helps them reduce fall rates, but also strength training increases neuroplasticity and slows neurologic decline. Smells are the funky one. This just came out last year. Again, this goes with an engaging environment. Different odorants, right? Different scents every night for a week, increased memory 226%. Just a crazy component, right? You don't want that static environment. I love this slide, even though it doesn't really fit in here, but morning light has been shown in several studies to be as effective as antidepressants in treating depression. So just get out and get that morning light. You'll let your seniors get that morning light. We have a couple tiers, passive controls and active controls with commercial lighting. And the nice thing about lighting is it's 100% compliance. You don't have to worry about whether or not they're following their protocols. You turn on the lights, it works. It's non-invasive, no side effects, and it doesn't build up tolerance. Commercial considerations for those of you in commercial facilities. We provide videos and collateral materials so that you can educate the people who are admitting their loved ones on why your lights are different. You want to fill and keep those beds filled longer. You reduce your medical errors, reduce your fall risk, lower your loss ratio for your insurance rates. And for your personnel, when they get educated on their sleep hygiene, it reduces their absenteeism and improves retention. We have a lot of things we go through on when we're designing a facility. You want to look at what they've got now, how they're being affected, both visual and non-visual, before we design the system. And to summarize, human-centric lighting improves those patient outcomes. If you're on a value-based care, you're benchmarking your star rating for facilities out there because you're reducing fall rates. Your reimbursement reduces risk, and you have the option of going for a no CapEx for energy savings as a service in a lot of facilities. So passive healthcare that increases mobility and reduces fall risk. How can you say no? So you install lights that replicate nature's light indoors. You educate your providers on what they're doing. We've found first shift workers want those patients sedate. Now they've got a little bit more work to do. They don't have the zombie daytime. So, you got to educate them why we're doing this, why we're helping people sleep better at night. Educating those patients and loved ones, improving the patient outcomes, especially reducing that fall risk. And you connect with us through LinkedIn, or you can contact me directly, and either I or a member of my staff we'll get back to you. So that is it. If you want data, I've got 3,000 peer-reviewed research papers. Here's just 9 of them. We've got 3,000 in our database. There are 25,000 out there. I haven't had a chance to read them all. But rest assured, this is clinically based fact. This is not hocus pocus mood lighting like you had in the 70s. And I'll turn it back over to you, Steve. Questions?
Wow. Yeah, we've got a few. And I am dropping those references into chat for all the other data junkies that are out there. But and David, is it okay if I share the slide deck on the recording link?
Absolutely.
Okay, cool. All right. So there's been a few questions led by Glenna on what can we do in our home? So like, let's just pretend we all listen to this. We know that this is important. What are some 1 or 2 steps that we can do to make our lighting more healthy in our personal residences?
So the first thing I recommend is, especially if you are, if you have seniors that you're caring for that have neurologic decline, dementia patients have a 5 times greater fall risk. So you need to make sure that you're putting in that underbed lighting. And I can send you some links. I should really set this up where I get paid on that. I don't get paid on it, but I'll send you some links on some resources where you can buy some of the products that are available.
The underbed lighting.
Underbed lighting is one. Sleep in complete darkness. The tiniest little bit of daylight coming in, or a little blue light on your, if you still have a VCR or a smoke detector or something, that blue light will disrupt your sleep. LEDs, if they're not properly configured, a lot of LEDs have greater than 5% blue enriched light, and you don't want that at night. That's enough to disrupt your sleep. So get a programmable light, smart light that will have less than 5% blue enriched light at night, or use an incandescent for your night lighting, and get outside the first hour of daylight, the first 20 minutes of daylight. Get outside when you wake up, and get that light exposure first thing, to really minimize your neurologic, or to really maximize your health and well-being.
Okay, so we got get as much natural light outside as you can, folks. And that's one of the reasons that the residents that participate in the Cycling Without Age that's here at Brightview, the only time a lot of them were getting out was going from the entrance to a car to go to a doctor's appointment or something like that. So getting out on the bike or just sitting out front in the light. You know, what you're saying about sleeping in total darkness, I don't sleep in total darkness. It's not even close in our bedroom. But when I go to a hotel room that has those blackout blinds, man, I tend to sleep really well, you know, when it is pitch black in that room. Now, Ruth says, I've installed LED lighting in much of my home, recessed ceiling lights, which significantly improved the brightness from the previous incandescent bulbs. Is this what you were talking about, or are you talking about doing something different?
People always think about it in terms of brightness, which is one component due to the aging of the lens, the yellowing of the lens. It's not really just about brightness. It's the blue content. You want 5 to 20, preferably 20% blue enriched light during the day. You want less than 5 and ideally less than 2 at night. When you look at the breast cancer rates in Europe versus Africa, it's a marked difference. They're at Africa's baseline. They don't have as much electric light, and Europe is, I forget the exact number, but it's a 5 to 10x the number of breast cancer rates up there. We need no blue light at night.
Okay. And is there a place like, I mean, I know, and if you want to send it to me, I can put it on the recording link, but like a website where we should go to buy our light bulbs or something like that. Because I'm assuming if I go to Home Depot, like, can I get the proper light bulbs?
Yes and no.
Okay.
I should actually set up something where people can buy. We've tested dozens
Okay.
of light bulbs, and we've found very expensive lights that had flicker. Found very expensive lights that didn't take out enough blue light at night. I'll create a list for you,
Okay.
Steve, of appropriate manufacturers. But even among those manufacturers, some of them, like we tried one manufacturer and they ended up going bankrupt. You have to download an app. You have to install these centralized hubs. The internet connectivity is critical, and God help you if you've got to change internet providers, because then you have to reprogram all the lights. It takes our team, about 11 minutes per light bulb to program some of these smart lights, and the automatic programming is not really that effective. So we're still working on that product. We're actually probably going to roll out that product in less than 6 months,
Okay.
where you'll have a product where you won't have that nightmare. For right now, that product does not exist with the latest in science.
Well, Michaela sort of took the words out of my mouth here. She says, "What are the magic words to use when buying lights at Lowe's? Or Home Depot. I know it might not be perfect, and we're going to get your recommended vendors, but for those of us that are just throwing lights in the light bulb, what should we be looking for?"
Smart lighting, so programmable smart lighting,
Okay.
high CRI, color rendering index. You want more than 90 or 95. You want no to low flicker, and take your camera, put it on slow motion, and go through all the lights at Home Depot and Lowe's. You'll be shocked at the flicker. It looks like you're going to get thrown into an epileptic seizure. And try to minimize the programming. You can use their programming for now. They've got some of them have a sunset to sunrise programming capability. Look for something on the app that does that. Wiz is a software program that uses that. There's some proprietary programs out there on some other manufacturers. So those are good places to start. And then, next time we do this, hopefully we'll have the right lights ready for you. And I've actually got a light list, a sleep email that I send my clients who are interested in improving sleep, which has research, behaviors you can change. Now, this is personal. This isn't for a business. Behaviors you can change, and then products you can buy. So, for example, back to the Glenn, I think had the Glenn had a question on what you can do at home. I actually have a chili pad or a sleep pad that allows me to adjust the temperature of my mattress, and I sleep on 65 degrees rather than taking the whole house down to 65.
Okay, yeah, and add that to the list too. And Jill is saying this isn't a question, but she wanted to let you know that if you can identify things on Amazon, you can set that up as like an affiliate link, and it's easy for all of us to order, and you could get a little commission too. But the sleep pad sounds interesting, and all this. Thanks for that, Jill. So stay tuned. I'll make sure, since I got everybody's email who is on this discussion, when I put it, when David gets me the links, I'll send everybody an email and let it, it's on the recording link. Now, somebody was asking, I guess you said something about smells. They wanted you to repeat that.
So there are devices you can buy that pump out smells, lavender, lemon, whatever that smell may be. And so those devices, when they rotate smells, right? You wake up on Monday and it's lavender. You wake up on Tuesday and it's lemon. You wake up on Wednesday and it's that spring day, whatever those smells are, just those changes in smells increased memory by 220+%. It just came out last year. I haven't spent a lot of time looking at it, but it's kind of interesting, and it ties back into engagement. Now, I will put in a plug for one of our partner companies called Pathogen Focus. For those of you in senior living facilities who are concerned with Candida auris, some of the other airborne and surface-based pathogens, we do not recommend UVC or UVA lights, because those lights that are designed to eliminate pathogens don't get in the shadows. Pathogen Focus has a product that converts airborne humidity into airborne hydrogen peroxide that's charged to attach itself to pathogens. It goes into every crevice, eliminates your risk of COVID-19, flu, etc. That also, the reason I brought that up is it makes, when you go into those facilities that have Pathogen Focus, it smells like a spring day. The maids will even tell you that if you've got it installed in your room. It's bizarre.
Okay. Myra asks, I have an electric digital alarm clock with large blue colored numbers.
Awful.
Should I cover the clock or take it out of my bedroom?
Burn it. Burn it, blow it up, destroy it, get rid of it. It's the worst. And those who sleep with TV on, awful. Your sleep runs in 90-minute cycles, and instead of getting these nice delta peaks, you get these little stumpy things. TV on is awful for you.
Okay. And then
now, for those of you who want to watch TV, you can buy glasses, and they're not the ones that you've seen on TV, this advertised on TV. These cost about $100 to $120, but they eliminate that narrow spectrum of light, that blue and rich light, that actually they eliminate that, so you can watch TV at night and not have the negative health effects and not have the negative effects to your sleep.
Okay. Got more questions, folks. We'll get to these. Let's see. Someone says, eating more food. Are you by chance familiar with the study that showed some restaurants used planned lighting and painted walls, or used drapes and decorated with certain colors to encourage increased appetites, thereby to stimulate people to eat more food? Have you?
Yeah. So color is closely associated with appetite. I haven't seen any studies that actually shown that the color of the paint on the walls or the curtains affect it. But let me tell you, light definitely does. So when you pump in a highly saturated, like a red, they always chintz on the red, you have a high CRI content, the food is more appealing. You want to eat more. And when it comes to sleep, like I said, if you sleep less than 6 hours a night, you increase ghrelin, which is a hormone that stimulates appetite, and you reduce leptin, which is the hormone that tells you you're full. So now you don't sleep enough and you wake up and you crave carbs and caffeine, you're more likely to be obese. And like I said, third shift workers sleep an average of 5.25 hours a night, 96% more likely to be obese.
Wow. Okay. Jill, thanks you for all this information. She's giving a presentation on aging in place, and you helped her with some additional data. And folks, I'll put the slide deck on there to reference all the links and things like that. Let's see. Okay, you're going to give us the links to some of the brand lights that you recommend and those details.
Now, that may take me a couple of days to get that.
Yep.
It might be by the end of the week. So everybody who's listening, check back by the end of the week. I'll have it done by Friday.
And I'll email everybody, okay,
right.
As well. But Glenna asks, is it okay to read in bed at night if the light is incandescent?
Yes.
Okay.
Absolutely. Incandescent light is about 2,700 to 3,000 Kelvin. It has less than 5% blue and rich light. I do not recommend reading at night on iPads. Don't look at your phone when you wake up in the middle of the night. Your phone is a super high Kelvin. It'll shut off your melatonin production. Again, within 10 minutes, 100% is gone in 10 minutes. 74% is gone in 5 minutes. So you just look at that for a minute, you've reduced your melatonin production instantly.
Wow. Okay, Mary says during a kitchen remodeler, the contractor told me I needed new lighting. Now I can't go in there at night because I feel like I'm entering an operating room. Is there any way to modify the lighting in the evening and in at night?
Depends. So if some fixtures have the LED built in, the only way to fix that is to replace that. And Mary, what happened is your contractor put in a high Kelvin light. It increases visibility. It's great during the day. It's awful for you at night. If you sense it's really, really white and bright, and it's not that nice golden feel you get from incandescence, you are absolutely waking yourself up, ruining your sleep, and damaging your long-term health. So if it's integrated into the fixture, you got to replace the fixture. But the good news is they're cheap, and you can get programmable ones or dim to warm. There's a company that I'll send you the link to that has a dim to warm feature. So you can dim it. And for those of you who dim, I'll tell you what kind of dimmer to use. You have to have one you can't use an old dimmer. The old magnetic dimmers will give you flicker like crazy. So you got to use an LED dimmer. But if it just has a screw-in light bulb, you can replace that screw-in light bulb with a light that's either, again, dim to warm, or a light that is switchable, or a light that's programmable.
Okay. And folks, we'll get that to you, these recommendations. Also, you can reach out to David too. I mean, I've got his contact information in chat, and reach out to him. And since we're getting close to the top of the hour, David, I know that you work with, senior communities and large companies to help with their lighting, but do you work with individual homeowners and consulting on their lighting choices?
I do, and I have. They can send me an email. I'd have to send it to one of my team to try to help them out. Hopefully, I can create an email that has, 80%. You're not going to get 100%, but at 80%. And it depends on the form factor, right? Some people have cans, what we call cans or downlights. Some people have screw-in, what we call A19s, or a typical 60-watt screw-in bulb. It just depends on the form factors that they've got in the house and the positioning. So what I recommend for these lights, now the average home in the US has 67 lights. That's a lot of lights. We recommend you put these programmable smart lights in your bedroom, bathroom, kitchen, and where you sit, especially for seniors. They've got one place they sit, right? It's a lounge chair, a recliner, or something. You want the light in those areas. You don't need to light everything else. Again, you want something where they're going to be exposed to it more.
Okay. Margie says, what are your thoughts on color?
It's called I hate getting technical, but it's called an SPD, which is a spectral power distribution. You want to have look at the curves that they have, and you don't want any blue light at night. You want to minimize that to less than 5%, which is why I recommend incandescent. There are some people for night, if you don't have less than 5%, there are some people in the industry, these are the academics, who believe that the mandate that we now have, a federal mandate to go to all LED without restriction on the quantity of blue light, is actually going to create a liability scenario for the public that is greater than asbestos, that is greater than cigarettes. Blue enriched light at night is like smoking 15 cigarettes a day. Who does that, right?
Wow.
Nobody.
Okay, Deborah says magnesium recommendations or magnesium recommendations.
Magnesium or manganese?
Magnesium recommendations.
I really don't know what magnesium is. If it's magnesium, you're stepping out of my wheelhouse. I'm a lighting guy, not a dietitian or nutritionist.
Yeah, Deborah, if you want to. Oh, sorry. She said sorry. Okay.
Steve, we lost your volume.
Uh-oh. Can you hear me now?
Barely.
Uh-oh. Okay.
Yeah.
Magnesium, she said.
There we go. Magnesium. Magnesium 3 and 8. This is for me personally, not I'm not a physician. Contact a dietitian or something.
Okay.
I'll tell you what I do personally for my diet. I need improvement there. I just have good lights. And I have these lights all over my house and my mom's house, by the way.
Okay, it says someone says colon cancer increased third shift and late night workers. Are you familiar with the studies that show those workers, because of the time of eating so late and their circadian rhythm out of balance and lack of exposure to natural light, might be the cause of cancers?
So what happens is you've got your third shift worker working in melatonin producing lights all night long, sedating them. They're fighting that. They're irritable. That's why a lot of abuse happens at night, right? A lot of the abuse cases in senior living facilities occur at night. They're frustrated. They're angry. They're not getting enough sleep. They sleep an average of 5.25 hours a night. So they're in these melatonin producing lights. You can only produce so much in a 24-hour period. Then they drive home. And what happens on the drive home is they see the blue and rich light. The blue and rich light shuts off all melatonin production, takes 2 hours to restart it. And now they're, instead of getting these nice deep delta peaks, they get these little stumpy things. They only sleep 5.25 hours a night. There's a little bit of blue light coming in through the curtains. They're not sleeping in complete darkness. Cancer rates are through the roof. You want to look at cancer rates for third shift workers. I mean, it's, I think I read one study that was 60% higher breast cancer, 58% higher prostate cancer. It's all bad. And then the eating gets disrupted, right? You don't want a heavy glucose meal before you go to bed because your brain feeds on glucose differently. I won't go into those details, but you need to limit eating within 2 to 3 hours before you go to bed. So just, nutrition is key, but it's not the main thing. The main thing is light, sleep, and health connect. They're integrated.
Okay, we'll get a few more of these questions here. I really appreciate your time. And folks, if you have to jump off, this is recorded. Steve says, I have a floor lamp. I have a floor lamp that is adjustable. I use blue in the morning and yellow in the evening.
Perfect.
That's ideal. Okay. And somebody was talking about aromatherapy and how that can help folks. It's especially folks, we did a discussion on aromatherapy and with people in dementia too, that smells often trigger memories and make us feel happier.
226% greater memory when you're rotating aromatherapy every night. Those odorants, which you can get for commercial facilities to pump out different smells every night.
This is Elizabeth. Great question here, Elizabeth. Asking if you ever work with other populations like, kids with disabilities or autism.
Yes,
you could see
huge difference, huge impact for kids with autism. I don't usually go after schools because the sales cycle's too long. It's 3 years, and then you got some guy who doesn't know what he's talking about, who's going to put up any kind of light. Autism, there are a number of studies on those, and I have a few of them. Parkinson's, MS, anything neurologic, light has an impact. And what I would encourage you to do for autism is, first and foremost, make sure you've got no flicker. Flicker causes neurologic agitation, neurologic malaise, and triggers migraines among migraine sufferers. When you have a communication disorder like autism, they can't tell you, I got a headache, I got a headache. Well, they're not going to tell you they got a headache. They just got a headache, and now they're off the reservation, right? So check for flicker. And again, no Apple 13, 14, and 15 because they changed the frame rate on their slow motion. Any other phone, slow motion, and record those lights, 5 seconds, play it back. If you've got flicker, you're going to trigger autism reaction.
Okay. We've got several questions and talking about glare.
Glare's a big issue, and it's a big issue as you age.
Okay, how can we reduce glare?
So seniors are even more sensitive to glare than the general population. So you want the lights not to be shining directly in their eyes. You want it kind of recessed. You'll see lights that kind of, shape the light down, and it's reflected light, not directed light. You want to minimize glare, especially for seniors. It'll be irritating for them.
Okay. Let's see. Well, what are what are some techniques to reduce that glare?
It's the positioning of the light,
Oh,
right?
positioning. Got it. Got it.
So
Okay.
make sure it's not an exposed light bulb. To use an example, just an exposed light bulb is going to have a lot of glare to it, especially if it's got that blue component. And again, I didn't go into this, but your retina is sensitive to blue and rich light, and it constricts when it sees blue and rich light and reduces retinal spill. So it actually creates greater visual acuity. I don't need my readers outside. I need them inside because I've got, well, I don't need them as much inside because I've got those lights blasting blue and rich light during the day. But that makes the retina constrict and it feels like it's brighter, even though it's not, and increases visual acuity. When you go from 5,000 Kelvin down to 3,000 Kelvin, you increase the visibility or visual acuity by 35%.
Wow. Okay. Jill says with the smells, you need to make sure they are not chemical based, as some are carcinogenic and can give headaches, like for her. That said, I've used hydrogen peroxide based active purification for 20 years and love it. And somebody else was curious about Jill's comment. Do you have any insights on that?
Nope. Out of my
Okay.
area of
So,
expertise.
Jill, send me an email because I really think that we could do a deep dive into aromas and smell and air purification. And that would be great.
Well, air
Um,
purification, I've got some knowledge on
got
that.
some
So
resources there.
remind me on that, Steve.
We could do a panel presentation there.
Yeah,
Cheryl says, I have Zevo in my outlets to catch bugs. The lights are blue. Is this bad?
it's bad at night. It's fine during the day.
Okay.
Just no blue light at night.
Okay. Okay. And Jill's going to send some info on the hydrogen peroxide, and we'll add that to the rest of this.
It's
So,
interesting she mentioned that because that pathogen focus product that I mentioned creates airborne hydrogen peroxide that's charged to attach itself to pathogens. And when you walk into a place that's got that, it smells like a spring day, and it seems like she
oh,
feels the same way.
wow, this is cool. All right. Well, man, no surprise. This was just as engaging as the first time I had you on. Uh, so yeah, and what you said is what you're talking about. So Jill, send me that. David, send me the resources. I'll send everybody out an email when I update the recording link, but I'll try to get the recording link up tonight if you wanted to share this discussion with folks. And David, I think we need to make this a regular thing because I don't think enough people are talking about about this.
I think as research comes out, there's more than 1,000 papers, research-backed papers on light's impact on physiology and neurology and sleep that are coming out every year now. Again, over 25,000 currently. So you're going to see a flood of this change in the products that are available, and our health and the health of our seniors and their vitality is going to increase. So thanks, Steve, for all you do to make this part of our population, this most deserving part of our population, have greater vitality in their senior years.
I love it. And Margie says she just did the iPhone test on some lights and she saw all the flicker.
There you go. Get
All
rid
right.
of it.
Well, folks, have a great day, and we'll look forward to updating the links. Dave, thanks again. Thanks for everybody who participated with your great questions. It always blows me away.